Borderline personality disorder is a personality disorder which is inflexible and pervasive in different psychosocial situations. It is characterized primarily by unstable emotions, unstable relationships, and unstable sense of self. This is also associated with intense fear of abandonment and rejection and a sense of emptiness. Borderline patients often tend to think in black and white. They often have extreme idealization, and then when they get disappointed, often devalue their own partners. Along with that, the rejection sensitivity can be very hard to handle, that leads to intense emotions. Hence, the relationships with patients with borderline personality can be very intense and tumultuous. Borderline personality disorder often have a lot of intense emotional outbursts and impulsive behavior that may look like bipolar disorder and often get misdiagnosed as that. They can co-occur as a comorbid condition, but usually the mood symptoms in borderline personality are more pervasive and last for hours to days, whereas patients with manic symptoms in bipolar disorder tend to have mood symptoms that are expansive, lasting for days to weeks sometimes. So there is a major difference in how they are diagnosed and also treated. Based on my experiences with my patients, what they describe this is a roller coaster of emotions, going from expansive highs and excitement to lows of depression and suicidal thoughts within the same day. They might have anxiety that may go to panic attacks and depression that might cause them to be suicidal and self harming. Families around them also start to feel anxious and edgy, making them feel like they are walking on eggshells. Patients themselves has a very intense emotional outburst that sometimes is very hard to control. Borderline personality disorder was previously considered to be a very difficult to treat condition. Today, with the new research and therapy options that are available, we have a very good success rate of treatment of borderline personality disorder. What it requires is an accurate diagnosis, a compassionate and validating provider, and the right therapy and treatment that is necessary for its treatment. So, with the right care, the patients with borderline personality can lead a fulfilling life.